What is a heart murmur? You know the sound of your heartbeat, lub-dub, dub-dub. In some people, the blood makes an additional noise because it flows through the guts. This sound is named a murmur, say, murmy. Doctors hear a cardiac murmur as a whooshing sound between heartbeats. The whoosh is simply an additional noise that the blood makes because it flows through the guts. Doctors usually discover murmurs during regular checkups or when kids see the doctor because they're sick. Just like kids, murmurs have grades. Grade 1 is that the softest sounding murmur, and grade 6 is that the loudest. A murmur graded 4, 5, or 6 is so loud you'll actually feel a rumbling from it under the skin if you set your hand on the person's chest. Most murmurs don't mean anything is wrong. But sometimes they're a symbol of a drag with the guts. Who gets heart murmurs? More than half all kids have a cardiac murmur at a while in their lives, and most heart murmurs don't mean anything is wrong. Doctors may call these innocent, functional, or normal murmurs. They're caused by blood rushing through the valves during a normal heart and are nothing to stress about. One common sort of normal murmur is Still's murmur, named for the doctor who first described it. This murmur is most frequently heard in healthy kids 3 to 7 years old. A normal murmur can get louder when the blood flows faster through the guts, like when kids have a fever or frolic. That's because a rise in blood heat or activity makes the guts pump more blood. When your temperature goes down, the murmur may get quieter or maybe disappear. It are often easier to listen to heart murmurs in kids because they need less fat, muscle, and bone between the murmur and therefore the doctor's stethoscope. Many normal murmurs become harder to listen to as children get older, and a few eventually disappear. What problems can happen? Even though most murmurs don't mean anything is wrong, sometimes a heart problem can cause a murmur. The guts may have a hole in it, a heart valve may leak, or a valve might not open all the way. If your doctor thinks your cardiac murmur might be thanks to a heart problem, you'll got to see a pediatric cardiologist, say PD at Rick Cardiologist. This type of doctor knows tons about children's hearts. What do doctors do? A pediatric cardiologist will ask inquiries to see if you have ever been in need of breath, had pain, felt dizzy, or fainted. The doctor also will hear your heart with a stethoscope, check your pulse, and hear your lungs. Sometimes the doctor might want you to urge a chest X-ray to ascertain if the guts looks bigger than normal. You furthermore might get an electrocardiogram (EKG), which measures the electrical activity of the guts. None of those tests hurt. Another test the cardiologist might do is an echocardiogram. This test uses sound waves to require an image of the guts as blood is pumped through its chambers and valves. It takes about 20 minutes and it doesn't hurt either. The doctor will take the knowledge from the tests and exam and determine if your murmur is probably going to cause a drag for you. A child with a cardiac murmur might got to take care about getting infections that would visit the guts. To stop this, your doctor will remind you to require extra excellent care of your teeth by brushing twice each day, learning to floss, and getting to the dentist regularly for checkups. Some kids may have to require an antibiotic before getting to the dentist for teeth cleaning. The doctor also may prescribe medicine to assist the guts squeeze harder, prevent blood clots, bits of thick blood which will block blood vessels, remove extra fluid from the body, or lower your vital sign. In some cases, surgery is important. Counting on the matter, doctors can patch a hole within the heart, fix a valve, rebuild a vessel, or stretch open a vessel that's too narrow. But most of the time, a cardiac murmur isn't an enormous problem. And most youngsters with heart murmurs can run, jump, and play a bit like everybody else. A cardiac murmur is just a sound. It isn't always the sign of a heart problem. Usually, it's just your heart whistling while it works.
I hope you are enjoyed watching this video about health issues. Comments, likes and share. Subscribe to our channel and learn more about new things. If you have any problem related to health, then you will contact health issue page.